guys, it's Dr. Roach coming back. So today I'm going to talk about presentations and working with your staff or your attending. So maybe you're a medical student, maybe you're a pre-medical student, maybe you are a PA student, nurse practitioner, maybe you are a resident. So giving presentations, so they're always intimidating, you're nervous, you're like, oh my God. First of all, are they listening to me? So no matter what we are doing, I am a staff pediatrician, so we could be signing an order that a nurse gave us, signing a physical form, typing what you're saying. Whatever we are doing, it doesn't matter. Just continue to talk, continue to present. We are listening, and we actually listen to everything. So the first thing I would say is be honest. So do not make up any history or any physical exam. Okay, so if you did not do it, don't make it up. So that's poor form for if you're documenting, so never do that. But also just don't lie about it. No one likes to hear about that. So I am a pediatrician, so I'm biased. I'm always gonna say if the kid came in, so if the kid came in with vomiting and you didn't ask if they had diarrhea, say, oh my God, I forgot to ask about that. That's a great point. I will go back in and ask. Sometimes we want you to go back in. Sometimes we'll just go back in together. So it just kind of depends. Fill out your attending and see which way they ask. But we always like to see that motivation, that dedication, that strive to be better. So always offer. So show interest. So also we like to see interest. So second thing being interest. So we like to see that you're motivated and you're interested in medicine. So no matter what you want to be, every rotation is going to be beneficial to you. So you could be a surgeon. So why would you hear about pediatrics? Like, I'm not going to work with kids, but you may have a patient that comes in. You may have maybe a trauma surgeon. You may have a trauma kid that comes in. So something on that pediatric rotation might have been helpful for you. So I always say take every rotation seriously, and we're here to teach. So most people that are in an academic institution or in a place that are taking students, they want to teach the next generation. So if we're here using our energy to teach, at least bring some energy back and seem like you want to learn something. So you should take something from every day, learn it, look it up. Read about one patient. Read about one medical diagnosis a day. I promise you, for your step exams, for whatever you have coming up, that will make a difference. So just taking that one patient and reading about hemophilia. So we'll say that. So reading about that, that's going to help you remember. So down the line, when you have another patient that comes in with that, you'll remember. So that's going to be very, very helpful for you. So last thing is writing it down. So I definitely was nervous when I was first doing presentations. Attendings may not seem like it now because, of course, we've practiced. We've practiced this for 4 or 5 years, however long we've been in practice, plus however long we've been in residency, plus however long we've been in medical school. So practice makes perfect. So if this is your first time presenting to attending, write it down. So come out the exam room, take a second, gather your thoughts. So think about SOAP note format. So think about, what did you ask that patient? What did they tell you? So summarize it the best you can subjectively. Then objectively. So that's your physical exam. That's the vital signs. So we like to hear those vital signs. Did you actually look at it? Did you look at the growth curve? Did you look at whatever objective things that you have? Then your assessment and plan. Number one thing that people forget is their assessment and plan. So don't forget to summarize. So we have a 4-year-old coming in with nausea, vomiting, and diarrhea suggested of acute gastroenteritis. Give us an assessment. It may be totally off, but we want to hear that you thought it through, okay? And then I always recommend that you come up with 3 differential diagnoses. So have 3 in your head. Your attendant may not want to hear all 3 of them. They might want to hear 10 of them. But have at least 3 in your head, because that shows that you have that little bit of medical foundation and you're thinking about your patient. So definitely think about the most common things that could be coming in for your patient. But write those 3 things down and then kind of, okay, why do I think it's this? Why do I think it's this? Why do I think it's not this? So kind of going through that in your head, that's a lot to take in. It's a lot to do, but it takes practice. So especially if you're going on rounds. So you have time before rounds to write all this down. When you're in a busy clinic, you may not have as much time, but that practice makes perfect. So just kind of keep practicing, volunteering to go see more and more patients, because that's how you're going to get better. hopefully this was helpful for you. It's a little snippet talking about presenting to your attendings. Hopefully this was very helpful for you. Feel free, ask questions, and check out my website. Have a good one. Bye-bye.